Hey everybody, um, this is video 7. My name is Dal, and today is January 14th, 2016. Yesterday I had um, they call it the exploratory endoscopy, but they also call it the gastroscopy. And it's part of the bariatric process, at least for me, where they, go in with they put you under, and then they use the scope and they go down your throat and they look at your stomach and they take the measurements and they look at the upper part of your intestine and just to make sure there's no infections and no kind of cancer, anything that may pose complications during surgery. So, Clovis Community Hospital in Clovis, California, did mine. Wonderful people, great facility. Everybody was, very kind and compassionate, and they were a little backlogged, so um, there was more time waiting to have the procedure done than the actual procedure being done itself. So, that being said, I was fine until they took me into the actual exam room. Then I became like a little anxious. And the moment I got in there, everybody was really attentive. The doctor was trying to, reassure me, and he was, making light jokes, that were appropriate. And the nurses were, strapping me with the monitors and all those things. And then the anesthesiologist was there, and he explained about the propanol and how it worked. And some of you may have heard it before. I call it the Michael Jackson drug. Um, but anyways, yeah, when I was there and he began administering the medication, I was out. There was no warning. There was nothing. And the cool thing about it is this drug works where it puts you to sleep, but you're able to respond to commands. And I thought that was really cool. And you don't remember anything afterwards. So when they're putting the scope down your throat, it's natural to have a gag reflex. So this keeps you from doing that. But the doctor can tell you to swallow, and you'll swallow to help the scope go down your throat. So afterwards, groggy, but it's kind of hard to explain. Except you're not. You just feel really relaxed and just real chill. Maybe a little confused, but not too bad. And it passes really quick. But don't drive. Don't do anything like that for the rest of the day. Even when you feel fine, your impairment is still, you're still impaired. So, yeah, so did that, and everything went great, and really excited. Um, Now, since they do put a little air in you, you do get like gassy. So that's normal. Um, and then like afterwards, my throat felt a little raw, but not too bad. It's the best way to explain it is like being in an area. This is even a harsh comparison, so it's gonna have to be scaled back. But being somewhere where somebody had smoked or there's some kind of air pollutant and it'll make your throat a little bit scratchy. That's what it's like. But a cough drop, or you can use chloroseptic throat spray, and it takes care of it. And it only lasted a few hours. Today, there's no discomfort. Um, there's nothing like that. I still feel a little calm afterwards. And there is a little sensation in my throat, but that it's more like knowing that there was a scope down in my throat. I know that's what it's from, just the movement and maybe a slight abrasion or whatever. But nothing that's distracting or discomfort or nothing at all. I know it'll probably be gone tomorrow. So my only step next is on the 25th. I have my psych eval. I passed one before. I mentioned in video 6 in one of my other videos. So I'm not really worried about it. I'm just really excited to finally be at this point where I'm getting really, really close for my surgery. And that's been like my driving goal. And I've always looked good for my age. And I've noticed that that I'm starting to show signs. And I'm worried. Well, yeah, okay. I'm worried that after the surgery about the excess skin. I know it's a reality, and I know it's just something I'm going to have to deal with. So, it's nothing that's going to sway my decision. I'm not going to be like, oh no, I need to stay fat so I don't have excess skin. No, I'll deal with it. I'll just deal with it. Anyways, so if you're out there and you are on this journey, just stay with it. If you're not happy with your doctor, switch. That's what I had to do, and since it was within a year, they accepted a lot of the stuff that I had already done. The only thing they didn't accept was, since I did complete the psych eval with Kaiser, they wanted me to have a new one because it had already been over a year, and it had only been over a year by like a month or whatever. So, if you're in this process and, if you're like 6 months in and you don't feel like you're getting anywhere, switch, go to someplace else where you do feel comfortable, because I think that's key. I have a lot of confidence in Dr. Keith Boone over at ALSA. Very nice people, professional facility, nice, clean, state of the art. And then all the places that I've been referred to for, to have all my tests done, just very, very professional. So when I was with the other facility, although it's clean and state of the art, I didn't have a lot of confidence because of their lack of bedside manner, pretty much. Just wasn't comfortable. I felt more like a chart number than an actual person. But that's my experience. But I'm happy that I made this choice, and I'm happy to be on this journey. And 2016 is going to be it, finally. So if you have any questions, ask. There's going to be a lot more videos, especially after the surgery. And I may have mentioned it, maybe I posted this on Facebook and not in the video, but I'm going to be moving out of California. And I'm going to be moving like after my surgery. So we're trying to get everything completed and have my surgery done. And so I'm going to be moving out of California. But, so yeah, I'm going to have to find another follow-up doctor, and like those follow-up exams, I'm going to have to find, I don't know. That's a whole nother stress for a whole nother day, I think. But I know what to do. I know what the diet is, and I know the vitamins, and so I'll get it done. I'm not worried. So stick with it, do what you need to do, and stick around, subscribe, please, follow, comment. If you hate it, if you want to know more, please let me know. Constructive criticism is always good, because, I post these to help you guys out. So, if I'm missing something or rattling on too much, just let me know. It's more out of nervousness. Okay, take care. Oh, just so I have this record too, yesterday when I went there, my weigh-in was 362 pounds. Yeah, damn Doritos. So, got to make sure the surgery is only going to be as successful as your willingness to lay down that junk food. I'm guilty, so it's going to be another thing I have to work on. Life is always about issues and working on something, right? Okay, well, that was it. Bye.